All right, let's see here. Did I get this? You can see my refrigerator in the back. You know what? Let's see if I can clean this. Did that do anything at all? No, I don't think it did. I think we need more light, but either way. My face is so shiny. Which makes me think of that Moana song about the shiny crab. Okay. Alrighty, let's do this. We've got 10 minutes. Hello all. All right, this is Allie. I'm a physical therapist. I'm a pelvic floor physical therapist, and I run my own private business here in Knoxville, Tennessee. So my business name is Belle Therapy Wellness, as you can probably tell by the name of the YouTube channel this is going to be on. So I need a way to put out information. So obviously, I feel like the physical therapy world, if you're a PT, then you get this. If you're not a PT, this is going to make zero sense to you. But we always say that the clinic is always years ahead of the research, just because what we see in the clinic day after day, patient after patient, it is, the research just cannot keep up with the speed of which people come to see us, nor, and I'm far past the belief that people are always textbook. I do feel like there are always situations that you hear about where I hear this all the time from patients. They will go on Google, Chat GPT, try and, look up their symptoms and try and make sense of it. And they come to me and they're like, I think I have this, but I don't have like other things that go with that. They're like, I don't really know what's going on. My doctor doesn't know what's going on. They told me to come see, a physical therapist. Can you please help me? So that's one of the reasons why I want to start putting out educational videos, very similar to this one. I realized that I have a certain way that I talk growing up in Tennessee. So excuse the accent. I can't do anything about it. What is that saying? You can't teach an old dog new tricks. You cannot teach me a new accent. You're just stuck with it. So all of that to say is that I just have a lot of stuff in my head that I want to tell like so many of my different patients, but I don't want to type up a text and send it to like 14 different people, because if you know me at all, you know me, I'm terrible at texting and replying. So I need a way to be able to get this information out there. And I also, have been discovering that, it's really hard to find good quality information. And as much as I would absolutely love for my patients to, empower themselves, look, find, learn, it's really hard to know who to trust, what to listen to, what is actually applying to you. Like, even though you may have symptoms of endometriosis, but you don't have it, via exploratory surgery, whatever, like people don't know what to listen to or understand. So that's kind of what I'm hoping to accomplish through these talks. So this is purely an intro video. I just want to say hi, who I am. Welcome to the channel. I'm probably going to put this out on YouTube first. Hopefully thinking about a podcast in the future. So, because I really like to talk. So, and I'm also very chatty. So if you have any topics, if you have anything that you would like to learn more about, please drop a comment below. That will also give me an idea of how to build a calendar and what topics to, schedule ahead for. I will go ahead and let you know, I definitely want to cover a lot of things: pregnancy, postpartum. I'm very exercise based. I love fitness. I love health and wellness. I obviously, I think as we age, you think more so if you're younger, you kind of look at it from like an aesthetics point of view. But, as I age, I look at it like I need to take care of my kids. I need to take care of my kids. I need to take care of myself, because I'm obviously of no use to them if my back hurts or I can't walk because I've torn my ACL for like the third or fourth time. Like, it's just, I've got to, we've got to take care of ourselves so we can take care of those that we love, in all seriousness. So this is about longevity. This is about taking care of ourselves. I'm going to try and bring you hopefully the latest and greatest in the research world, but also just from what I have seen in so many women I've treated at this point and talked to, and hopefully my knowledge and expertise can hopefully help you. And of course, if you have any questions, please let me know. I want to be a resource. Email is the best way to communicate with me. If you want to start leaving comments in the videos, I think that would be great. I would like to get better at checking those. That is a New Year's resolution for 2026. So hopefully you'll be seeing more of these. I'm not really sure if I'm going to continue to hold the microphone like this because my thumb is now going numb. So yeah, I know I probably need to do something to fix that. So we'll be getting there. So anyway, stay tuned. Lovely to have you here. Thank you. If these topics are of any interest to you, I'm going to rattle some off real quick. Like I said, pregnancy, postpartum, health and wellness, exercise and fitness. Would love to do some stuff on endometriosis, perimenopause, hormonal fluctuations, uterine fibroid cysts, PCOS, adenomyosis. Man, the list can keep going. Being a woman is fun. Sorry, that's heavy sarcasm. Being a woman is fun. We're very blessed. Anything else? Yeah, that's honestly just like the cherry on top. That's not even getting into the full cupcake. So stay tuned. We'll see ya. And if you have any topics, please drop them below. Thank you. Fun.